Hello, friends and partners. I'm so glad and I'm so humbled to speak to you today. I am Dr. Paul Mulyamboga and I serve here at Amigos Internacionales as the Director of Medical Services. And I'm so glad to speak to you on behalf of the whole family of Amigos Internacionales on what we are going to be doing in the eastern part of Congo as we support the Ebola response program. For several years, the DRC has faced multiple epidemics and most of them have been managed by the authorities. Of many of these epidemics, many of them have been locally managed with most of the partners on the ground. We, unfortunately, are faced by yet another of these epidemics. Ebola broke out and multiple people have been affected. The Bundibugyo virus, which is a strain of the Ebola virus, has affected so many people in the eastern part of the Congo. Amigos Internacionales, together with our partners, are coming together to support the Ebola response in the eastern part of the country in partnership with the Marie Claire Foundation, an organization located in the DRC, working locally with the local authorities and the health authorities in the DRC to ensure that we curb the spread of Ebola. It is a reality on the ground, the fact that over 34 of these communities that are affected, both in the northern Kivu region and in the Ituri province, are being affected by the Ebola as the main hotspots of this virus. We have seen it through the news. I'm very sure you have heard about it in your news outlets, but the sad reality on the ground is that the people on the ground and the communities being affected by this are being isolated and many of their potential support being diverted away. It is so sad of the unfounding realities on the ground that we have visited, that we have seen. These are realities that we live with every single day, of mothers not being positioned to access health care, of communities being completely cut off, of not having enough food, of not being in position to access the right health care that they need in this epidemic. It is a sad reality as Christians that we cannot sit back to watch what is happening. I am here to speak to you about the new initiative that we are coming up with. Amigos Internacionales, together with our partners, Doctors on Mission, will be working directly with the health authorities in the DRC and our partner foundation, that is the Marie Claire Foundation, and we are going to be working together to ensure that the health workers have all the necessary protective measures for them as they treat patients, but also to intensify surveillance in the community for those that are suspected to have been in contact with the cases that have been identified, and also to ensure that those that are under care receive the necessary medical care, but also the nutrition they need to get through this virus. This is a multi-sectorial project, and I know that by the grace of God, we are going to be in position to achieve it. A lot has been said in the past, but this is the reality as per the government of DRC. Over 1,180 people are currently having been exposed to the virus, and only 184 of those have recovered from it. There are over 34 communities that have been affected by the Ebola. Of the 34, only 24 have been accessed, have been reached by health care. It means that there are several others that we have not yet reached. It means there are many hotspots that are yet to be identified and even reached. And that's the purpose of us being a part of this. It is a sad reality, I have to tell you, what is on the ground. Communities completely cut off, people completely cut off, and some of those dying. It's a sad reality on the ground. And by the grace of God, we are stepping up not only to watch, not only to hear, but to act. That act starts now, and it starts by your donation to this initiative. Talk to us at Amigos Internacionales and ensure that you'll be part of something much bigger that is coming up. as we launch this big program to support the Ebola response in DRC, I call upon you to pray for us, to pray for the volunteers, to pray for all the teams that are locally working in the DRC, but most importantly, to give and to donate to ensure that the work we are doing right here in DRC is made possible and just continues, to ensure that every last patient is reached. Friends, as you sit wherever you are in your sitting room and wherever you are watching this from, the realities on the ground in the DRC, especially in the eastern part of Congo, which is most affected by this, are true. People go without food, communities are cut off, and people are dying. Speak to us today. Be a part of something bigger. Join us in this program. May God richly bless you.